Karen and Tim, Memphis Morning News Time is 6:15. Weather Service says today, high back near 70 degrees. It should be a beauty peach of a day. Karen Parent, well, every now and then I do have to take a little something for some of this hip pain that I have playing too many sports out there. Apparently that may not necessarily be the best of both worlds.
May not be. We're going to check in now with medical expert Dr. Al Johnson talking about acetaminophen. And I think a lot of people have mixed emotions on acetaminophen, but there's some new study out that's saying acetaminophen may dull your emotions. Good morning, Dr. Al Johnson.
Good morning.
Now, I was a little surprised to hear this, as far as dulling your emotions, because honestly, sometimes I feel acetaminophen does a big bunch of nothing for me when I have a headache, and maybe that's just me.
Well, yeah, that's exactly correct. It depends on what the cause is.
Okay.
Acetaminophen works, of course, on the brain, and it decreases pain. But most pain medicines also affect other parts of the brain. And it's not surprising when you look at the physiology that it does dull the emotions. Most pain medicine do to some sort. And this study was done at Ohio State by grad students and with psychological and testing with response on healthy individuals, they found that occurred.
Now, I find it interesting when we think about acetaminophen, that's one of the first things as a parent that you're allowed to give your infant children for pain relief. So when I think of acetaminophen, and it may be wrong to think this way, but I think of it as one of the lesser dangerous, if you will, of the different pain medications. But when you hear a study like this, you figure out that may not be necessarily the case. I know you have to be careful if you're having acetaminophen and alcohol and things like that. That can be very bad for your liver. But when you think it's okay for an infant to take in small doses, and then you hear a study like this, it's strange to me.
Well, exactly, is in that medication is generally considered safe if the guidelines are followed for the age of the patient, the weight of the patient. Recently, they decreased the amount of acetaminophen in combination pain medicines because in higher doses and repeated use, it does affect the liver, particularly in older people and people with metabolic problems. So any medicine we use needs to be used cautiously, follow the prescriptions, and like in this case, it would be called recreational because you weren't using it for a specific pain purpose, you were just taking it.
Dr. Al Johnson, a medical expert, doctor of internal medicine, joining us this morning on Memphis Morning News. Dr. Johnson, and I know that the headlines that we got Friday in preparation of all this, acetaminophen may dull your emotions. Can you talk a little bit about its impact on serotonin or endorphins? And I know I just throw those words out because those are only two of the scientific words that I do know.
Well, it does work on the pain centers of the brain. And the study didn't really address the issues that you just mentioned. We know that serotonin is involved in depression. If you have low serotonin, you tend to be depressed. This is just a generalized depressant of emotions, which occurs with pain medicine because it works in the central part of the brain. So any of the medicines that is used for pain would probably note that. Now, given that, if you have a headache and the headache is dull and you just feel like you cannot concentrate, and you take acetaminophen and it relieves that headache, then you notice a positive effect, and that's what most people do. So you got to realize this study was done on people with no symptoms.
Well, that does make it a little bit different because, I find that, I know they've cut back on the amount of acetaminophen when they mix it in with some particular pain relievers. But when you've got a product, for example, Excedrin, I find that little mix of the caffeine, the acetaminophen, and the aspirin is a pretty good mix for a headache I have. But I can't imagine just taking acetaminophen for no reason. That's just craziness.
Yeah, well, that's what this study was about. It was doctor students at Ohio State that did a study and then got it published. And so it's important we talk about these things so that people understand that when you take medicine, it does help symptoms and is meant to be used for that. But if you take it when you don't need it, then you can expect all different kinds of side effects.
True. Very true.
Dr. Al Johnson, medical expert and doctor of internal medicine, joining us this morning. Now, they say have any other non-steroid anti-inflammatory drugs, any of the others such as ibuprofen? Has there been a study on anything like that? And if so, have they seen any kind of similar results?
To my knowledge, no. And in this article, they said they were going to study other medications. Okay. And I would suspect they would find the same type of response in that they are pain medicine. They're expected to dull the senses regardless of what kind they are or how they're classified. So I would expect the same results. Okay. So the message is, if you have a problem, use the medication appropriately. Don't take it if you don't need it, because it may have and possibly does have side effects that are detrimental to your function.
That's very interesting because, like I say, it's interesting to me how they perform these studies anyway, but it's interesting that you would take a pain reliever or study a pain reliever on someone who's not having pain at all. But I guess you got to study a little bit of everything in this medical business that you're in.
Well, exactly, and people are looking to publish and trying to figure out studies when you're in grad school to publish and to get through. So this is one that they decided to look at, and I think it's a good topic to bring up because people should not take depressants, pain medicines, those type of things if you're not having problems, medical problems, because they do have side effects.
And that's probably another topic for another day, the fact that people get on pain relievers and then they cannot get off, and that's a whole problem in this country in itself.
Exactly, and the addiction is a big problem. And inappropriate use of the medicine for recreational purposes.
Dr. Al Johnson, thank you so much for joining us and learned a little bit about acetaminophen this morning. A little bit more than probably I wanted to know, but probably needed to know on that. Thank you so much for getting us some safety information on this.
Oh, you're welcome.
Have a great day.